Hi, welcome to Wellness Wednesday. Today's topic is bladder health. And bladder health is often considered as a sensitive subject, yet it's crucial for overall well-being, especially as we age. And understanding how our bladder functions and changes over time can help us maintain better health. This session will cover the various bladder conditions that may arise, important conversations to have with your healthcare provider, and much more. Today we have two guests. We have Lindsey Williams. Lindsey is a co-founder of MyUTI and a strategy and product commercialization, sorry, expert with extensive urology experience, and she has a personal passion for improving women's health and is most happy building creative solutions that empower women to take control of their health journeys. And along with her is Megan Henken. Megan is also co-founder of MyUTI and is an accomplished global marketing leader specializing in the area of women's health, urology, and clinical diagnostics. So having personally experienced the impact of frequent UTIs, she is channeling her industry now, know how to improve the lives of women. So I'm going to hand it over to Lindsey, and let's give her a warm welcome.
Well, thank you so much. I appreciate that. I think we're going to pull up a presentation. Today, we're going to be talking about bladder health as you age. And I think when we're ready, Megan, if you'll give me the thumbs up.
Yep, we're seeing the slides.
Okay, perfect. Thank you. So today we're going to keep this session practical and empowering. So this isn't just about facts. It's about helping you understand your own body and options so you can feel confident asking the right questions and getting care that fits your needs. Bladder health has a big ripple effect. And when you're worried about leaks, frequent urges, or bladder pain, it can affect your sleep, your social engagement and outings, and even your mood, maybe especially your mood. The good news is many of those issues are manageable with the right type of support. Like every part of our body, the bladder evolves over time. So these changes can affect how much urine your bladder can hold, how easily you can sense fullness, and how strong your control is, especially during stress, sleep, or with sudden urges. Now, there are several different conditions that can affect the bladder or the urinary system. And today we'll go through each one, what it is, how it shows up, how it's diagnosed, and what treatment or lifestyle changes can help.
All right, so let's talk about overactive bladder, or what you may have heard from your physician is called OAB. And OAB is one of those common conditions that happens as we age. It is that sudden and frequent urge to use the bathroom, that gotta go feeling. And in fact, I'm sure you guys have seen some of those drug commercials, gotta go, gotta go, gotta go right now. That is what overactive bladder is. And it occurs even when your bladder is not full. And for some, it becomes extremely disruptive at night. So what can you do as you look at testing, treatment, and lifestyle? One good thing that you can do, and something that your physician may ask you to do, is keep track of a bladder diary. Now, this may be something that they give you a sheet of paper that you can write down the frequency in which you're using the restroom, or there are apps that are very simple to use where you can just very quickly mark off the number of times you're using the bathroom during the day as well as during the night. And what it really helps you do is identify these patterns in the behavior. What your physician may also ask you to do is a urinalysis or a urine culture. And the reason they'll test you for a UTI is they're looking for bacteria to see if that maybe is what's causing the spasms in your bladder. Because part of OAB is ruling out that there is an infection that is causing the symptoms. So once they know that it is overactive bladder, there are treatments that they can provide. This is everything from antibiotics, and then they can also put you on bladder retraining exercises that really helps you space out the frequency in which you're using the restroom. There are also things like Botox that you can inject into the bladder that will help with the spasms as well. When you look at lifestyle type considerations, your physician may recommend staying away from caffeine, which I know can be hard for many of us. But even simple things like soda or things that are carbonated can also trigger some of those bladder irritants. So those are some lifestyle things to consider if you are managing overactive bladder. Lindsey, incontinence, or do you want me to keep going?
Nope, my bad. I had to find the right screen. Apologies, guys.
Good.
So not all leaks are the same, and knowing whether you leak during an activity or due to a sudden urgency can help narrow down the cause and guide best treatments. So incontinence is leakage, and there's different types. Stress incontinence happens like when you laugh or sneeze or cough, or maybe if you're a woman who's had childbirth, if you run very quickly or try to jump on a trampoline. Urge incontinence comes with a sudden strong urge. And overflow happens when the bladder doesn't empty completely. And so maybe you've gone to the bathroom and then just right at the very end, when you think you're done, there's just a little bit more that comes out. And this can affect both men and women. And testing might include, pad tests where they will measure how much liquid or urine is coming out by weighing pads. There's also different types of bladder function studies that a specialist may recommend. And treatments can range from pelvic floor physical therapy, exercises and devices, all the way to absorbent products, medications, or in some cases, even surgery. And then, of course, lifestyle changes like limiting caffeine or alcohol, things that can have bladder, irritation or cause bladder irritation can make a big difference as well.
So the topic that we are very familiar with, and some of you familiar faces that we're seeing here today, urinary tract infections. These are very common as we age, and especially in women. And for women, urinary tract infections are due to hormonal changes that make you more susceptible to those infections that cause the really frustrating repeat symptoms like burning and urgency and pelvic pain. But UTIs can be tricky as you age, especially in older adults. It isn't just the classic burning or urgency that we typically associate with a UTI. Instead, you can feel foggy or tired or just off. So these symptoms are also something to really pay attention to if you do have a history of urinary tract infections. So when we talk about UTIs, the critical factor is an accurate diagnosis. So you really want to make sure that you have testing performed to understand if you in fact have a urinary tract infection. And part of that confirmatory testing is understanding what is the bacteria that was there and responsible for the symptoms that you're experiencing. So it is, and the reason that's critical is because the bacteria that they identify in your sample drives the decision on the antibiotic they should recommend for you. When you look at treatments beyond antibiotics, there are things for menopausal women. There's really strong evidence around using vaginal estrogen. There is the consideration of supplements. So cranberry supplements, or there's another polysaccharide known as D-mannose. And those can be really great at helping you manage your bladder health, as those coat your bladder and with proper hydration help you flush out what is in your urinary tract. And for both men and women, hydration is key, because if you do experience constipation that makes you more susceptible to UTIs. And we really just want to make sure that we are maintaining that really good bladder and gut health through hydration. You know, a little personal story here to kind of share about repeat UTIs. My grandmother was experiencing them quite often, and she had been put on low-dose antibiotics. What I found out is she was not only taking those, but she was also taking the other antibiotics that she was being prescribed from her primary care provider and then also her gynecologist. So she was doubling up on her meds. So I think we really need to be careful, even though we may have multiple prescriptions that are given to us by our provider, that we're talking to our entire care team and letting them know everything that we're taking, because the more often you take antibiotics, the more you're exposed to a specific antibiotic, the less effective they become. So in her case, she was becoming, the meds that she was on were becoming ineffective because she was taking them so often and on a repeat basis. So just really important to have the full conversation with your team and make sure you're taking the drugs appropriately and during the correct duration in which you should be.
I don't know if anyone here has heard an old adage that as we age, our noses and ears don't stop growing. And I actually found out that is not technically true, but what is true is that your prostate does continue to grow. And as men age, the prostate does tend to enlarge. It's not necessarily caused by cancer, but it can make it harder to fully empty your bladder. So your prostate actually sits right underneath your bladder, and your urethra goes through essentially the middle of it. So as it grows, it kind of pinches that hose, if you will, and can make it very difficult to completely empty your bladder. And this can mean frequent trips to the bathroom, maybe a lingering sensation of not having completely emptied your bladder after you've just gone to the bathroom. And these symptoms tend to kind of show up gradually. I know with my own father, I started to notice that he was, frequenting the restroom more often. And he would tell me, oh, I'm just staying more hydrated. But as his symptoms progressed, he actually started to think that he was having UTIs. And what ended up happening was that he was retaining liquid urine in his bladder that was giving him other symptoms, right? But because he had BPH that needed to be addressed or had gone undetected by him, that was causing some of the issues. So when thinking about BPH, testing, diagnosis, and treatment, diagnosis might include a rectal exam to feel for the size of the prostate manually, can include a PSA test, or an ultrasound to see if they can determine the size of the prostate. Your treatments can range from, a daily medication to relax or shrink the prostate, or possibly even procedures. There's some minimally invasive procedures and surgeries that can be performed in order to reduce the size of the prostate. The right treatment is going to depend on your symptoms and how much they're going to interfere with your life. So there are, from the simple medications or to the minimally invasive procedures, it's really about coordinating with your care team and finding out what is going to be right for you and for your lifestyle. And then regarding lifestyle, certainly there are tips. You're going to want to maybe limit fluids right in the evening before bed so that you're not disrupting your sleep as often. Things like that can be done. Obviously, you don't want to get to a point of dehydration, but timing with fluid intake can help the management of BPH be a bit more manageable for your life.
All right, let's talk about pelvic organ prolapse. Prolapse can feel like a heaviness or a pressure in your pelvis. So as women, we have, men too, but your pelvic floor is basically held by a hammock. And so this is holding in your bladder, your vagina, your colon, everything there sits in it, your uterus. And so as some of those organs shift down, that's where it can feel, as some women describe, as even sitting on an egg. And what happens when you start to get the signs and symptoms of pelvic organ prolapse is you do have some leaking. You may experience painful intercourse, and you may have a hard time completely emptying not only your bladder, but also your bowel. And pelvic organ prolapse is extremely common. It affects a lot of women after they give birth. And then may also, if you don't experience the symptoms after childbirth, you may start to experience some of these symptoms when you're postmenopausal. And that's really just because of the way that we age. And so that support tissue loosens and weakens. Getting a diagnosis for POP or pelvic organ prolapse is relatively simple. You'll want to see a gynecologist. They may send you to a urogynecologist, but you'll want to have a simple vaginal exam. So if you are experiencing these symptoms, make sure you get that vaginal pelvic exam to confirm that you have a prolapse. There are multiple types of prolapse, and there's different grades of prolapse. So you'll want to make sure that you understand exactly the type and the stage that you have, because that will direct your options as far as treatment and lifestyle choices that you make. From a treatment standpoint, you can look at things that are minimally invasive or what they consider non-invasive. The image here shows what is a pessary. And so a pessary is a device that you do insert into the vagina, and it gives you a little bit more support. And it is something that is removed. It can either be removed by yourself, or you go into your physician and they remove it and clean it for you. From a lifestyle standpoint, it really just depends your level of activity and your comfort level. If you are doing CrossFit and experiencing leaking, and when you're running or doing jumping, you may want to use a pessary at that time. Or depending on the severity of your prolapse, it may be something that you need to move into more low impact exercises. You do, again, want to make sure that you are eating a good diet, high fiber diet, to mitigate constipation. And as we're probably going to say over and over again here, hydration is key, making sure that you're getting enough for yourself each day. So what can you do if you are experiencing these symptoms? We've covered quite a bit today, everything from conditions that impact both men and women, but things that are specific to men like BPH and women like prolapse. What can you do to prepare for your doctor's visit? And the biggest thing is bring your notes. Your doctor has limited time. I think we all recognize this. You know, many of us are in and out of the office. And while it can seem frustrating, it can be really helpful if you have all that information together right then and there, because then they can escalate your care if necessary, get you that referral to a urologist or a urogynecologist to do things, get a little bit more of an assessment done if necessary. And you can do things simple as just writing down notes, and be specific about the goals and things that are important to you, because there are specific symptoms that may bother you more than others. And that is what's important about shared decision-making with your care provider, because when you're looking at conditions like incontinence, we often think of a cure being zero leaks. And the reality is that just may not be attainable for many of us. So the goal may be, instead of getting up 4 times in a night, let's move that down to 1, right? Or with leaking, right? Where we, through therapy and behavioral interventions, we may be able to reduce the number of leaking episodes we have a day, because we're able to strengthen that pelvic floor. Also, when you look at intimacy and sexual activity, making sure that you understand if that is a trigger for any of these conditions, and talking about that openly with your provider as well, because they can also provide support in that area. And it will dictate the recommendations that they make in the treatment process that you get into.
Now, if you're a caregiver, you can know that behavior changes like confusion or increased falls might be the first sign of a UTI. And be sure to encourage testing to confirm or rule out an infection. In general, with any of these bladder conditions, encourage testing, not guessing. You can ask your provider what the types of tests would be necessary based on your symptoms and find out if it's the best fit based on what you are experiencing. You can ask about prevention, help the person that you are caring for in terms of advocacy by being involved in their care. And certainly that means, either helping them prepare for an appointment or maybe attending that appointment with them. And then I think the biggest thing is, respecting dignity and privacy. Certainly, this is a situation in which you want to just make sure that we're providing respect for those who are going through it. A lot of times, especially with things that involve the bladder, it can be embarrassing. And we want to make sure that there's no shame involved in providing care. And then, of course, if you're a caregiver, don't forget to look out for yourself, because caregiver stress is real and it is okay to ask for help, whether that's additional educational resources or asking for someone else to step in to be able to take a short break. Okay, let's bust a few myths. So leaks are not just a normal part of aging. That is a big myth. And also, men get bladder issues too. I think oftentimes we hear about it more with women, but certainly men can have bladder problems. Urgency can be treated, and not all urinary symptoms mean a UTI. So there's, again, kind of that testing, not guessing, making sure that you know what it is that needs to be treated. And another myth, prolapse doesn't always require surgery. As Megan mentioned, there are many effective pessary options, things that don't necessarily require invasive procedures. There are some educational resource and support foundations and resources here. MyUTI.com is a website. We have a lot of blogs and educational articles around these types of topics specific to urinary tract infections, as well as some other bladder conditions. Urology Care Foundation is a wonderful organization with a lot of resources. NAFC is a continence resource. And of course, Senior Planet has many, many tools and discussion forums for you guys to access for some additional support. I want to thank you guys so much for your time today and listening to this presentation. We appreciate the opportunity to come and talk about bladder health as you age.